This is an article that came out in the Courier Journal, part of the USA Today network, March 16th, 2018. Overdose deaths are out of control. Louisville is battling back with this massive plan. Louisville unveiled a massive 2-year plan Friday to fight the city's drug epidemic and curtail overdose deaths that are more than double the national rate. Mayor Greg Fisher and Dr. Sarah Moyer announced details at a news conference in Portland. The plan addresses early intervention, calling for more treatment and extra help transitioning from recovery centers to jobs. We are living through the biggest drug plague in American history. We sure are. With nearly 500,000 people dying in the past 15 years from drug overdose, most from opioids, according to the report. Come together for hope, healing, and recovering, a plan to address substance abuse and misuse in Louisville. Currently, an average of 115 people across the country. They keep going to this 115 number. But if you remember, Trump's opioid commission said 175. So I'm not surprised they're trying to lowball the number because look at how bad the situation is. In Louisville, the overdose fatality rate is 43 deaths per 100,000, is more than double the national rate. It's largely due to opioids, including heroin and fentanyl. The plan takes a collaborative approach and uses best practices from other communities, according to a joint statement by the mayor and Moyer, director of Louisville Metro Department of Public Health and Wellness. Dozens had input on the plan, including treatment centers, educators, police, clergy, doctors, prosecutors, jail officials, paramedics, health officials, and those struggling with addiction, including syringe exchange participants. Boy, they put a lot of thought into this. I don't remember. The only thought they put into the crack epidemic was throw them all in jail. That didn't even take 5 minutes to come up with that thought. Okay. Males are the most at risk, with 468 dying from 2011 to 2016 compared to 214 females. During the same time, 90 Black men and women and 11 Hispanics died. Paramedics and emergency medical technicians rushed to overdose calls in every Louisville metro zip code in 2016. And the number who died has continued to rise every year since 2011. Acute heroin poisoning in Louisville metro led 5 times more hospital stays in 2016 than in 2012, according to the 77-page report. Opioid-related hospitalizations were 2.5 times higher. Other drugs such as cocaine. Okay, so what they're really saying is, everything is going up. But one thing I want you to notice in this whole thing, there is still no punishment for the user. Until they deal with the user, nothing is going to change. There is no way you can come up with plans for the drug dealer, plans for treatment, plans for drug court. They got plans up to wazoo, but the plague keeps going strong. And it keeps going strong is because they're trying to coddle and not deal with the user. Without them doing that, this whole thing is going nowhere. It's going nowhere. It doesn't matter. I don't care if they came up with a 277-page report. It's still going to be a massive die-off in America from all of these drugs. It's not going anywhere. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell twice and join me over on Black Junction TV and blackspot.com. Peace, family.